Frustrated because you had to skip another workout because of knee pain? Maybe you're wondering, how much more can I realistically continue to modify my workout? Is that even the right answer? I know how frustrating it can be to feel like every single squat or lunge is just making your knee pain worse. But before you ditch your lower body workouts altogether, let's talk about what you can potentially add to your next workout routine in order to help decrease your symptoms of knee pain. Hi, my name is Brittany. I'm a doctor of physical therapy and strength coach, and I work with active adults, including gym athletes, who are wanting to decrease their pain and discomfort in their workouts. Instead of sitting out due to fear or limitations, I help active adults build bodies that are strong and resilient, that help them feel confident with movement again. Right now, you're probably thinking, or maybe you even read somewhere online, that in order to heal or fix your knee pain symptoms, you need to avoid anything that aggravates or causes knee pain and just completely take time off to rest. Maybe you've tried icing, heat, wearing a brace, or foam rolling, and you're wondering why none of these things have given you the long-term relief that you're looking for. I'm here to tell you that none of these things are actually going to work, at least not for you. Yes, these things may work for some people out there, but those people likely don't live the same lifestyle that you live and have goals to get back to the same types of things that you have goals to get back to. And as someone who is an active adult and values being able to lift weights, run, hike, and play sports, I understand exactly where you're coming from. Settling for, well, just don't do that anymore, or you're just getting older from your doctor is not going to cut it for you. And that's exactly why in this video, I'm going to show you how to take the active approach you need to help overcome your pain and symptoms, and how to use movement to help overcome your pain, build strength, and heal your body so that you don't have to be worried about giving up the things that you love doing. So let's dive in. When we talk about things that we're going to add to your routine and things that we're going to modify in order to help you overcome your knee pain symptoms, we're going to divide this into 3 different categories. The first is your warm-up. A warm-up is important because it's the time that you're helping to prepare your body for the demands of the type of workout that you're going to be doing. And when you're experiencing knee pain, it's even that much more important to make sure that you're doing a proper warm-up before you dive into your workout. During your warm-up, you want to make sure you're focused on activating muscles around the knee, as well as movements that help to strengthen your knee under a loaded position. And the first exercise I recommend adding into your warm-up is called a terminal knee extension, or TKE. Terminal knee extensions are a great way to activate and strengthen the quad muscle, which helps to support the knee joint and improve stability. To set up this exercise, you're going to anchor a long band at about knee height to a squat rack or something similar. You're going to put the leg of the knee that has symptoms inside the band and take a few steps back so that you start with some tension. The knee is going to be slightly bent and your heel is going to be off of the ground while you're supporting most of your weight on your opposite leg. From here, you're going to gently pull back on the band, activating the quad muscle and then allowing your body to slowly return back to the starting position. The next movement is a progression or a variation of this movement, and it's called a step up with a terminal knee extension. To set this exercise up, it's going to be very similar to the first exercise. You might want to raise the band a little higher depending on how high the step that you're using is. The step is going to go essentially where you were standing for the first exercise. This time you're going to use that same leg and step up onto the box as you pull back onto the band, and then slowly allow the knee to bend as you return back down to the starting position. This movement combines quad activation with a functional movement pattern like the step up, which makes it a great movement prep exercise for leg day. This exercise also helps to strengthen the quad muscle, which helps to stabilize the knee, but also helps to reinforce proper knee control through a range of motion. And the last exercise for the warm-up is going to be a lateral eccentric step down. To perform this exercise, you want to grab a small step. The higher the step height, the more difficult the exercise will be, and the lower the step is to the ground, the easier it'll be to perform. Start with the leg of the affected knee on the step, and the opposite leg is going to be off to the side of the step with those toes pointing towards the ceiling. You're going to tap the heel of the opposite leg down to the floor while keeping your weight on the leg that's on the step. Another thing you want to watch out for is making sure to keep your hips level as you perform this exercise. This exercise helps to work on eccentric control and loading of the knee, which has great carryover for being able to perform movements like squats and lunges in your workouts. Now we're going to move into our main lifts. Many people think that just because you have knee pain, you shouldn't work out and you should avoid movements like squats and lunges because they are considered bad or unsafe for your knees. This actually isn't true at all. In fact, it's better to modify, adapt, and keep moving than it is to just remove these exercises from your programming altogether. Stopping a movement doesn't make you better at performing that movement. Instead, it's better to bring down the intensity or load of performing that movement to a tolerable level that works for you, and then slowly work on rebuilding that movement back up over time. The first adaptation you can make to your workouts if you're experiencing knee pain in the gym is a barbell box squat. You also don't have to perform this with a barbell. You can easily also perform the same thing with dumbbells or kettlebells, or simply just do it body weight. This allows you to still train the squat movement pattern, but modify the range of motion to a height that is tolerable and doesn't cause your knee pain to flare up. And for an added challenge, you can play around with the tempo to make this more challenging. Decreasing the speed at which you perform this exercise, or even adding a pause at the bottom of the movement, is going to require you to have a lot more control over the weight as you perform this exercise. And I promise you, it's going to be a lot more challenging. The next adaptation you can make to your programming in the gym if you're experiencing knee pain is going to be a heel elevated goblet squat. I like this variation because it forces a more upright posture or positioning compared to performing a normal barbell back squat. This exercise variation also helps you to strengthen that knees over toes position in a much more balanced way. Strengthening the knees over toes position is actually key for long-term knee health because it actually mimics a lot of the things we do in our day-to-day life as well as in the gym. Over time, movements like this will help to increase range of motion and joint strength while also decreasing risk of injury and improving performance. With proper progressions and control, movements like this can help your knees tolerate load more safely and function better overall. And lastly, let's talk about what accessory movements you can add to your workout in order to help support your knee pain. These accessory movements are important because they not only help to improve strength and stabilization around the knee, but they also help to strengthen other areas of the body that help to reduce stress and load on the knees. These include joints like your ankles and your hips, as well as muscles like your glutes and lateral hip stabilizers. Working on these areas will help you to build a strong foundation for movement, which is key to preventing pain and improving long-term knee health. Without them, you're missing out on big ways to build resilience and reinforce strong movement patterns. The first accessory movement I recommend for knee pain is a single leg bridge or hip thrust. This exercise is great for knee pain because it helps to strengthen the glutes and the hamstrings, which are part of your posterior chain. And strengthening the posterior chain is important because it helps to provide stability for the hips, which in turn will help take stress off of your knees. The knee is a joint that is in between two other major joints, meaning that it is largely affected by what happens above and below it. So if your hips are super strong and stable, that's less work that the knees have to do. But if you have weak hips, that means that the knees are likely going to have to take on more load and have to work a little bit harder. The same is true for the ankles, which brings us to our next exercise. The next exercise I recommend is going to be a dynamic ankle mobility exercise. This exercise targets both ankle mobility and strength, both of which are important for active adults, but especially active adults who are managing knee pain. Just like the hips, if the ankles or feet are tight, stiff, or weak, or both, this can affect how forces are translated up through the foot and ankle into the knee. If your foot is strong and moving well, it's going to be able to properly absorb forces, which again means that the knee has to do a little less work. If you have a foot or ankle complex that is stiff, tight, not moving well, or weak, that can cause more forces to translate up the lower leg into the knee. This exercise helps to improve both mobility and strength in the foot and ankle. And the last exercise is a side plank with a hip abduction. This exercise helps to target the smaller glute med muscles, which are key for stabilizing the hips and pelvis and providing proper alignment and control of the knee. This exercise also helps you work on lateral core control. A strong core helps to create a stable base for your limbs to move, helping you maintain better posture, control, and joint positioning during your lifts. Now let's finish off by answering the question, should I continue to work out with knee pain? If you haven't guessed already, the short answer is yes, but while keeping a few things in mind. The first one being use modifications. We don't want to fall close to either end of the spectrum where we're completely ignoring the fact that we have knee pain and continuing as if nothing's wrong, but we also don't want to be sitting at home on the couch all day hoping that our knee pain just goes away on its own. The second is make sure you're continuously monitoring pain levels. On a scale of 0 to 10, we usually say anything that is between a 0 and 4 is okay to keep working through. Once your pain is higher than a 4 out of 10 with exercise, we want to make sure we're looking for a modification or adjustment of some kind to performing that movement. If you modify or make an adjustment and you're still having more than a 4 out of 10 pain, that may be an exercise that you want to temporarily table until you're ready for it. And the last is to think about the time frame. If you've had pain for more than 4 to 6 weeks, it's probably time to reach out to somebody. I always tell people it's better to address and fix these problems while they're still minor versus waiting until it's been 2, 3, 4 years and your symptoms are consistently at a 6 or 7 out of 10 pain. These things can likely be addressed a lot easier in a lot less time if we approach them when they're still a smaller issue. If you want support getting to the root cause of your knee pain, figuring out what's driving your symptoms, and building a plan to stay active without consistently flaring up, I want to invite you to book a consultation with me using the link in the description below. During this call, we'll walk through your symptoms, your training history, your goals, identify what might be contributing to your knee pain, and identify what the best next steps are for you to move forward with confidence and clarity. I'll leave the details and booking information in the description below. And if this video has helped you, make sure to drop a comment or like this video so that I know to keep making more content just like this. And don't forget to subscribe for more tips on pain-free training. Thanks for watching, and I'll catch you in the next one.